thought about kind of 4 things that states ought to be thinking about and focused on for day one to minimize the bumps in the road. The first I'd offer is the importance of the assisters and navigator programs out there. They are indeed the front lines of health reform to consumers. They need to be well-trained, certified, and importantly coordinated in the messages that they provide, the policy, if you will, the procedures that they articulate, and well coordinated with the health insurance exchange service center staff and Medicaid staff. And it's worth noting there are actually 4 different categories of assisters. There are the navigators that we know about from the Act. There are in-person assisters, or IPAs. There are agents and brokers who, as many may know, can continue to be compensated by issuers but can't serve as navigators or IPAs. And there are certified application counselors. So the point being that individuals and families will be coming through multiple channels to receive this assistance from existing call centers. Some states have as many as a half dozen existing 800 numbers that consumers call for information. These new exchange customer service centers, the navigators and assisters I've mentioned, as well as local county and public health offices because of the no wrong door provisions of the Act. So coordinating and communicating is very, very critical there. Not every application also on day one is going to follow what we call, I guess a technical term in the industry, a happy path transaction. So the happy path is really what we envision with this goal of really click to card, where everything's done kind of seamlessly through a website clearly. That's a great goal, and that's something I think we continue to strive for as we move toward Exchange 2.0 and beyond, as well as things like mobile applications and so forth, mobile platform use. But in addition to those types of transactions, certainly there'll be consumers that will be applying for exemption and exclusion from the individual mandate. They will want to ensure that the income that's being used for their eligibility is more current income than might be available through the Data Services Hub. And so having individuals that are well-trained in these customer contact centers to handle those types of transactions is critical. And ensuring, and this is something that we can learn from the Medicaid and CHIP world, creating special escalation units of more knowledgeable and fully trained individuals to handle those more complex cases can be an effective day one strategy. And then lastly, 2 other quick points. One is that regardless of whether a state is a state-based exchange, a federally facilitated exchange, or a state partnership exchange, and we can talk about those definitions shortly.
And I gave you, there's a handout that shows the map of which states have which.
Perfect, perfect. It's important to note that there are certain provisions of the Act that create requirements, ongoing requirements for those states and their operations, the no wrong door provision being a critical one. So ensuring that there's a choreography, if you will, between the local public health department offices and county-based offices where eligibility is currently determined, existing call center operations, the federal call center operations, and so forth, is critical. States have to make decisions still, for example, as to whether they are going to be a screen and refer state. So if they're in the federally facilitated exchange, will they simply get the information from the federal exchange and have it passed down and make final determinations at the state level, or will they have the federal exchange make that eligibility determination? Regardless of what they choose, however, they still own the responsibility for that case going forward and maintaining it. And then finally, the 4th thing that states, I think, are very much focused on is insurance market readiness, ensuring that qualified health plans are available for selection by consumers, that procurement process has effectively run its course, and that information can be uploaded, if you will, to the website to be presented in a good format for consumers to make a choice.